Bridget, the Integrative Medicine Approach to the Healthcare Crisis in the United States, is the book that I've just written. The preface, I want to just read it to you in case those of you who don't have access to Kindle books or like it read to you. That's how I prefer to read books too. The preface is, this book started in July 2019 because I wanted to tell the story of how I've been working since 2009 to change the healthcare crisis at the time. It was meant as a way to reach out to millions of Americans who use complementary and alternative medicine along with traditional medicine and find a way to unite us in promoting integrative medicine in our healthcare system. Now, as the book is being released, the whole world is faced with the global pandemic of the coronavirus COVID-19. We are all in social isolation or quarantine. Our daily habits, our work, our social lives, our way of eating and connecting have stopped. Now is the time for reflection on the things that matter most. The protection of our families, our responsibility to our communities, our loyalty to our nation and humanity, and compassion towards our fellow human beings. But first and foremost is our commitment to our own self-care and self-nurturing. It is the way we will keep our immune system going as well as improve it during the crisis. If there was resistance from the Western medical groups to integrative medicine, those barriers will be eliminated. Because the medical system cannot withstand the amount of the virus it's creating, and the cases are increasing. They need to look outside the current healthcare system and ask for help, which they've done. And for those holistic practitioners who struggle with the Western medical approach, they now realize that it's an imperative for those who need life-saving equipment and medications to take their next breath. So we have to have both. We are going to come out of this with layers of medical, spiritual, emotional, financial, and social effects for years to come. We will have to rebuild our community, our economy, and our lives after this crisis. We get to decide what kind of people we are during this crisis and after. Maybe we'll have to make difficult decisions and changes after we are reminded of what really matters to us. We have choices on how we want to rebuild our lives. This is also an opportunity to rebuild our healthcare system as well. Here are my ideas, but your opinion matters the most. What do you want your healthcare to do for you? Whether you're the doctors, the hospitals, the insurance companies, or the patients, we can all agree something has to change.